Our obsession with immediacy, productivity, and speed permeates almost every aspect of our society here in the United States. Fast living, being in the fast lane, fast tracking in our careers are commonly seen as positive attributes here among all of us. So it's really no wonder then that this emphasis on timeliness has spilled over into our healthcare system. And in many ways, this is a good thing. In fact, patients and payers alike share similar values when it comes to time. Immediate access to care, a prompt diagnosis, perhaps the development of the most efficient treatment plan, all are viewed as common expectations. Yet, despite significant improvements in the provision of care here in the United States, our system is often criticized for its lack of caring, personal touch, and empathy. When patients reflect on their interaction with the system, they often come away with this feeling of a one-size-fits-all experience that's focused on speed and efficiency, but lacks that human connectedness. A model that values and rewards the number of encounters versus the meaningfulness of an interaction between a patient and a provider puts at risk any of the benefits that are perceived or are achieved through efficiency and speed. This dilemma presents a significant challenge to us here today in the United States. So I would ask that you consider this idea of slow with me today as applied to healthcare. Slow is certainly not a new concept, and many of you here this evening are familiar with the slow movement. Generally, it's associated with the opening of a McDonald's franchise in Rome, Italy, and it was a food critic, Carlo Petrina, in 2002 who expressed outrage and the opinion he was totally outraged on how a fast food giant could literally take hold in a city that's recognized around the world for its culinary arts, and thus became the slow food movement. Since that time, this notion has gone global, and now there's the expanded ideas of slow parenting, slow travel, slow science, and more recently, slow healthcare. The key characteristic of the slow movement is this idea of quality over quantity. And the overarching theme is the importance of recognizing the pace of our lives in a way that enhances versus diminishes our experience of being human. In other words, having the wisdom to know when speed is and speed is not necessary in our activities of daily living. The slow movement certainly doesn't call for the slowing down of all aspects of an activity in our lives, but really the purposeful and the ongoing reflection and the effects of doing everything fast. Slow care applied to our healthcare system today is an idea worth sharing because there's considerable disagreement in the United States on how best to proceed with designing and implementing a system that is not only efficient, but effective, sustainable, and is able to acknowledge that we, as recipients of that care, are humans. The idea that slow is useful and available for every practitioner in the field of healthcare is real. We can use it across a continuum of services in a variety of settings, and it really has application to so many different things that we encounter in a day-to-day provider world. For example, a surgeon in the operating room, or a nurse working in a clinic, or perhaps a community health worker making a home visit can benefit their patients by using this model. But there are serious barriers in our current system that affect the ability to integrate slow care. And it was really in the early 70s when our government first decided that we needed to approach our system in a manageable way. We needed to manage healthcare. And the intent was to create competition and to control cost. Well, since that time, which is almost 45 years ago now, I think most of us would agree that our healthcare system is recognized as an industry with obligations for productivity, limited variation, and maximum efficiencies. We've borrowed from the car manufacturing process and the aviation industry. We've embraced total quality management, continuous quality improvement, and all of these alphabet soup programs in an effort to improve the process of care. And our intentions have been good, but yet healthcare providers hear every day from their patients that they need more of an encounter, more than a navigator, more than a care map to experience what you and I would recognize as an acceptable level of health. Our system today is designed to triage everything. Practitioners, in order to maintain that throughput in a system, have to expedite care, and sometimes either consciously or unconsciously making decisions to cut corners, which then compromise quality or predispose that patient to experiencing errors or perhaps a negative patient outcome. And while there are a growing number of slow care advocates, primarily physicians, and we're seeing more of the concepts related to slow care integrated into the educational programs for healthcare professionals, our efforts are really overshadowed by the continued perceived need for speed and efficiency and control of costs. And I'm certainly not here to bash fast. When you're sick and when you are ill and you need resuscitation, or you need a hemorrhaging wound sutured, or you need an emergency operation, fast is good. I'm all about fast. It's good. And we're pretty good with fast here in the United States. But I do have to ask the question of, does everything benefit from being fast? And of course, I say not. And literally, slow care is about slowing down the care so that people like me, a registered nurse, can frame my perspective and my attitudes in a way that first and foremost acknowledges the person that I'm caring for as a human being and not a widget. And I know that seems like such a simple and non-complex idea, but we hear from our patients, and maybe some of you have experienced this. When you encounter the system, you don't always feel valued as a human being. And as a provider, I know that the evidence is there that suggests that sometimes we have doubts about our ability to provide the scope and the breadth of care that we really know is necessary. 40% of primary care physicians today feel that they don't have an adequate amount of time to spend with their patients. The time motion studies tell us that the average encounter is 13 to 16 minutes, and most patients say that they're commonly interrupted after they voice their chief complaint. Every day, I talk to colleagues in my field that say they feel like the proverbial hamster on the wheel, with barely enough time to address the priority needs of their patients, let alone the other needs that are looming in the background and are equally of concern. For the practitioner that can complete that encounter in speed dating style, they come away not feeling as though it's a victory. That time spent with the patient is wasted, and the failure then to connect with the family and their loved ones. And for the practitioner that gets caught up in this work harder, longer phenomenon, oftentimes they're predisposed to burnout, and we're seeing more and more people exit the profession entirely. The commodity of time in the slow care model is viewed as an investment versus an expenditure of resources. It's about spending the right amount of time with a patient, not worrying if it's too much or if it's too little, but spending the right amount of time. And it's about the patient also being able to request additional time if they have the need. Slow care is definitely about holistic care. It's about seeing the patient in their entirety, not a hip fracture, not a mental health case, and not a list of symptoms. It's about creating an environment that they experience in a holistic way, not in silos of specialization or dissected body parts. It's about recognizing that they are a holistic person. I think that Dr. Victoria Sweet says it best when she compares fast and slow care. And she says that fast care views the patient as a machine and the provider is a mechanic. In slow care, the patient is viewed as a plant that needs nurturing and the provider is the gardener. In slow care, the gardener nurtures, and in fast care, the mechanic fixes. In slow care, the model also emphasizes that the patient is an individual, but within a context of a family unit, a community, an environment, and they present with their own cultural background, their own unique values and beliefs. This is in direct contrast to a one-size-fits-all protocol that really frowns on and looks at as negative when there's variation and any sort of uniqueness. Slow care is also relevant in this growing population that we have here in the United States of people that have multiple chronic illnesses and perhaps are approaching the end of their life. It makes perfect sense to slow care so that people in those situations can fully weigh their options, can decide with their family what's best for them in whatever time they have left. Slow care also embraces this idea that it's okay to wait, or to proceed with caution, or perhaps to do nothing in lieu of an expensive or an aggressive plan of care. Those of us that embrace slow care, we're not averse to technology and innovation. We recognize that robotics and machine learning, virtual reality, all of that is in various stages of development and it's here to stay. But we do ask the question of whether or not we're looking for technology to really provide solutions to problems in our healthcare system that are more human-oriented. And I ask the question of when you think of a machine that becomes the intermediary between a patient and a provider, does that really enhance or diminish care? There's a significant need, and I believe an ethical responsibility, to study the effects of technology and to really determine whether its use enhances or diminishes the care we provide. Providers that use computers to access the electronic health record during a patient visit spend 1/3 of their time looking at the computer screen. In a slow care model, as an example, providers are freed up from the multitasking, from the focusing on more than one thing at a time. They focus solely on the patient, not just to hear their chief complaint, but to hear their whole story. We know that when patients are provided an environment to tell us their whole story, that we're more likely to understand the root cause of their symptoms. This sort of an interaction helps us to provide the right words at the right moment and the right intervention. So today I have two takeaways for you, and the first is this, that slow care is really about the idea that there's sufficient time to provide to meet all of the patient's needs. And the two words that are important there are sufficient and all, to do the well, to provide the needs that really enable the patient to live that quality of life that you and I recognize as a true quality. And also the need to find this balance. It's not that fast care is not important, but we need to find the balance. We need to do things at the proper speed, not everything at an accelerated speed. And some say that it's too late. We're too far down the path for these concepts related to slow care to be integrated into our healthcare system today. But I don't believe that. I think that we can do better. I think that we can do better than what we have right now, and we can find that balance between slow and fast care. There will be people that oppose the idea, and they're likely the ones that are benefiting from the system the way it is right now. And in the days ahead, this conversation is going to play out. We're still struggling with what health is going to be here in the United States. I hope that when you're presented with the opportunity to weigh in on this very important conversation, that you'll remember that it's the human connectedness that really helps us to achieve that quality of life. It's that preservation of being human that makes our lives worth living. It's that experience of enhancing our lives versus diminishing them that makes us the caliber of people that we want to be. So I hope that you'll feel empowered to weigh in on this very important conversation. Thank you.